Good morning, medical students. Today, we will be diving into the fascinating world of otorhinolaryngology, specifically focusing on the topic of stridor. Stridor is a clinical symptom characterized by abnormal, high-pitched respiratory sounds caused by airway obstruction. In order to fully comprehend this complex condition, we must first understand the intricate anatomy and physiology of the upper respiratory tract, including the larynx and trachea. The upper respiratory tract encompasses the larynx and trachea, vital for breathing and sound production. Stridor, abnormal breathing sounds, can originate at different levels. Diagnosing and managing it requires a comprehensive assessment, including history, physical examination, and diagnostic tests such as laryngoscopy or imaging. To comprehend stridor's pathophysiology, a strong understanding of respiratory physiology is essential. Breathing involves diaphragm and intercostal muscle coordination to create negative pressure, allowing air into the lungs. The upper airway maintains airflow, but obstruction causes turbulent airflow and stridor. Evaluation and management require understanding the physiological consequences of airway obstruction. Stridor can have various causes, including congenital anomalies like laryngomalacia and acquired conditions like subglottic stenosis. The underlying mechanisms involve issues with laryngeal cartilage or vocal fold movement, resulting in airway narrowing and turbulent airflow. Accurate diagnosis and treatment rely on understanding these factors. In this section on recognizing and assessing stridor, we discuss the importance of obtaining a detailed history and performing a comprehensive physical examination. These evaluations help determine the characteristics of stridor and provide important clues regarding its underlying cause. The characteristics of stridor, noisy breathing, can provide important clues about the underlying cause. By analyzing whether it occurs during inhalation or exhalation, the pitch, and the temporal pattern, medical professionals can narrow down potential causes and devise appropriate treatment strategies. Diagnostic investigations, such as imaging studies like X-rays, CT scans, or MRI, and laryngoscopy, are important for identifying the cause of stridor. Additional tests may be needed for complex cases. Summarized, treatment of stridor depends on the cause, severity, and individual factors. Conservative measures like observation or supportive care may work for mild cases. However, surgical interventions, such as endoscopic procedures or open surgery, may be necessary for more severe or persistent cases. Management should be tailored to each patient's specific needs and considerations. If not managed properly, stridor can cause serious complications. It can lead to respiratory distress, respiratory failure, and even be life-threatening. Long-term consequences include developmental delays, cognitive impairment, and airway scarring, emphasizing the need for accurate diagnosis and appropriate treatment. Given the diverse etiologies and potential complexities associated with stridor, interdisciplinary collaboration is of utmost importance in providing optimal patient care. Anesthesiologists, otolaryngologists, pulmonologists, and other specialists often work together to manage complex cases and address the specific needs of each patient. In situations requiring surgical interventions or procedures under anesthesia, coordination between the anesthesia team and surgical specialists is crucial to ensure the safety and well-being of the patient. Communication and a shared decision-making process facilitate a comprehensive evaluation of the risks, benefits, and anticipated outcomes of the proposed interventions. In addition to the core medical team, involvement of allied healthcare professionals, such as speech therapists, respiratory therapists, or physical therapists, can also be invaluable in optimizing patient outcomes and providing support throughout the treatment journey. Stridor in children presents unique challenges due to anatomical and physiological differences. Etiologies include laryngomalacia, tracheomalacia, vocal cord paralysis, and congenital anomalies. Management approaches vary based on severity and comorbidities, employing conservative measures or surgical interventions. Specialized care, regular follow-up, and child-friendly communication are crucial. As medical professionals, it is essential to stay at the forefront of advancements in the diagnosis and management of stridor. Otorhinolaryngology is a field that continuously evolves, with ongoing research and technological advancements improving our understanding and treatment of various conditions, including stridor. Keeping up with the latest scientific literature, attending conferences, and engaging in ongoing professional development activities are key to providing evidence-based care. New diagnostic tools, innovative surgical techniques, and novel medical therapies are constantly being explored, offering potential breakthroughs in the management of stridor. Active participation in research initiatives or collaborative projects can also contribute to expanding our knowledge and advancing the field, ultimately benefiting patients with stridor. Empowering patients and their families with knowledge about stridor is vital in achieving optimal management outcomes. Patient education should focus on providing information about the identified cause of stridor, triggers or exacerbating factors, and strategies to prevent or minimize episodes. Education about the importance of regular follow-up appointments, maintaining proper hydration, avoiding irritants or allergens, and recognizing signs of worsening symptoms is essential. Appropriate counseling and guidance promote patient compliance with medication regimens, lifestyle modifications, and scheduled interventions. Clear communication, patient-centered counseling, and the provision of educational resources in easy-to-understand formats help foster a collaborative relationship between healthcare professionals and patients, ensuring that stridor is effectively managed in the long term. To conclude, stridor is a complex symptom requiring a thorough understanding of its anatomy, physiology, assessment, diagnosis, and management. Collaboration between specialists, tailored care for pediatric cases, and staying updated on research enable evidence-based care and patient education. Your understanding as future healthcare providers is crucial in improving patient outcomes.